Welcome back, all of you, to Mock Test Explanation Series Part 32 for Government Nursing Officer exams for various government nursing officer exams like RRB, ESIC, AIMS, JIPMAR, UPSC Nursing, PSC Nursing, etc. The first question: what is the main purpose of ABC analysis in material management? Option A: to control purchasing. Option B: to control inventories. Option C: to control obsolescence, and option D is to determine stocking. The right answer is option B, to control inventories. ABC analysis is a popular inventory management technique. It categorizes inventory items into three classes A, B, and C based on their importance and value to the business. You can see the chart for more details about ABC analysis. Next question: iron supplementation in a healthy breastfed baby should be started at the age of option A 2 weeks, option B 4 weeks, option C 8 weeks, and option D 16 weeks. The answer is option D 16 weeks. Iron supplementation for healthy term exclusively breastfed infants should typically be started around 4 months of age. 4 months of age means it is 16 weeks of age. This is because human milk, while beneficial, has low iron content, and iron stores in the baby's body develops at this stage. Iron supplementation can help prevent iron deficiency anemia, a common problem in the first year of life. Next question: which of the following gases is used in sterilization of medical equipment? Option A ethane gas, option B methylene oxide gas, option C methane gas, and option D ethylene oxide gas. The right answer is option D ethylene oxide gas. The gas used in sterilization of medical equipment is ethylene oxide, or ETO. Next question: best site to demonstrate capillary filling in infants. Option A nail bud, option B sternum, option C ear lobules, and option D great toe. The right answer here is option D sternum. Most of you might have selected nail bud as an answer, but the best site to demonstrate capillary filling in infants, often referred to as central capillary time, is the sternum of chest. Applying pressure to the sternum for a short period and observing the time it takes for color to return is a reliable way to assess the perfusion. So sternum is the right answer for infants' capillary refilling test. Next question: in dengue fever, the vector is option A Culex mosquito, option B Aedes aegypti, option C flavivirus, option D Toga virus. The right answer here is option B Aedes aegypti. Here the first thing is you have to distinguish between the vector and the agent, because the organism or causative agent is different and the vector is agent. Here we are mentioning about only the vectors. So here vectors are not virus, the mosquitoes. So three kinds of mosquitoes like Culex, Aedes, and malaria. There is a chart to connect the different diseases which they transmit. Culex, the word is Jaf, and Aedes, the word is my diseased. My diseased. So these short forms, if you remember, you can connect the words. First, let us see the Culex. Jaf is Japanese encephalitis, avian flu, and filariasis. So these three diseases are caused by the Culex type of mosquito. And Aedes, my diseased, that is the first letters of the diseases: Mayaro fever, yellow fever, dengue fever, chikungunya, and Zika. So these all diseases are caused by the Aedes mosquito, and malaria is caused by the Anopheles mosquito. So these three types of mosquito and the related diseases you have to by heart for better performance in your upcoming exams. Next question: Jacquemer sign is also known as option A Osiander sign, option B Chadwick sign, option C, Goodell sign, and option D, Hagar sign. This is also one of the most frequently asked question. Please let us go to the right answer. The right answer is option B, Chadwick sign. Here also the same way I have used color codes and short code for connecting the related terms so that you will avoid confusion. Jack is equal to Chad, Good is similar to Hagar, and OC is similar to Palmer. So we will see what is the similarities here. Jacquemin sign is blue is purplish discoloration of vagina, and Chadwick sign is another name of Jacquemin sign. So these greenish highlighted areas for Jacquemin sign and Chadwick sign is similar thing, same thing. Bluish purplish discoloration of vagina is Jacquemin or Chadwick sign. But here Goodell and Hagar you compare, that is highlighted in the blue color. Goodell sign is softening of cervix and Hagar sign is softening in the consistency of uterus. So here softening is happening. So that's why Goodell and Hagar is similar. One is softening of cervix and the other one is softening in the consistency of uterus. Then Osiander and Palmer is also similar. You can see Osiander sign, pulsation felt in vagina, and Palmer sign, uterine contraction felt during the bimanual examination. So both are having a feeling or felt. The pulsation felt in vagina is Osiander and Palmer sign is the uterine contraction felt during bimanual examination. So Jack, Chad, Good, Hagar, and O.C. Palmer is the short connecting words to remember these signs without any confusion. Next question. Word No Tobacco Day was observed globally on option A, 31st May, option B, 2 June, option C, 15 June, and option D, 20 June. The right answer is option A, 31st May. World's No Tobacco Day is observed annually on May 31st. Next question. At which of the following weeks of gestation does the uterus normally reach the level of the syphilis sternum? Option A, 32 weeks, option B, 36 weeks, option C, 40 weeks, and option D, 42 weeks. The right answer here is option B, 36 weeks. The uterus normally reaches the level of the syphilis sternum, the lower end of the sternum or breastbone, at 36 to 38 weeks of gestation. So the right answer is 36 weeks in these options. Next question. In which ecosystem the vegetation is dominated by grass and herbs? Option A, forest ecosystem, option B, grassland ecosystem, option C, tundra ecosystem, and option D, desert ecosystem. The right answer here is option B, grassland ecosystem. The grassland ecosystem is characterized by the vegetation dominated by grass and herbivorous or non-woody plants. The ecosystems are often found in These kind of ecosystems are often found in regions with insufficient rainfall to support forests but more than deserts. So the areas in between the rainy area and desert, that kind of mid-rain areas, the grassland ecosystem is found to support the trees or plants. Next question. Forceps should not be used in option A, twin delivery, option B, hydrocephalus, option C, forced maturity, and option D, after coming head of the breech. Not used. This is a negative word question, so be careful. The answer here is option B, hydrocephalus. In hydrocephalus, forceps can potentially cause further damage to the skull, leading to higher risk of complication with the hydrocephalic condition. So, in hydrocephalus, forceps cannot be used. Next question. Ammonia is a compound with the molecular formula of option A, N2O, option B, NaHCO3, option C, NaOH, and option D, NH3. The right answer here is option D, NH3. Ammonia is a compound with molecular formula of NH3. This is the right answer. Other terms you see, N2O is nitrous oxide, or it is otherwise called laughing gas. NaCO3 is sodium bicarbonate or baking soda, and NaOH is sodium hydroxide. Next question. Which among the following hormone is secreted by pituitary gland? Option A, calcitonin, option B, glucocorticoids, option C, glucagon, and option D, prolactin. The right answer is option D, prolactin. Let us see the hormones and the corresponding glands. Calcitonin is produced by thyroid gland. Glucocorticoids are by the adrenal gland. Glucagon and insulin, it is produced by pancreas, and the prolactin is by the pituitary gland. So here the right answer is option D, prolactin. Next question. During suctioning, the patient complains of respiratory distress. First nursing action should be option A, immediately remove suction catheter. Option B, suction rapidly in 5 seconds and remove the catheter. Option C, call senior nurse. Option D, call doctor immediately. The right answer here is immediately remove suction catheter. This is an application level multiple choice question. So here the condition is during suctioning the patient complains of respiratory distress. So the maximum time allowed for your suction is 5 to 10 seconds. So if the patient is getting distress, you have to immediately remove the catheter and see whether the saturation is getting improved or not. Suction rapidly again in 5 seconds will further worsen the condition. So this is absolutely a wrong answer here. Call the senior nurse and call the doctor immediately. Can be done, but it is not the first step. The first step is immediately remove suction catheter. Next question. At what stage of labor episiotomy usually done? Option A, first stage. Option B, second stage. Option C, third stage. And option D, fourth stage. The right answer here is option B, second stage. An episiotomy is typically performed during the second stage of labor, specifically when the baby's head is crowning and pushing against the perineum. You can see the figure, the baby's head is coming down, and during that time, that is the second stage of labor, the episiotomy will be done to facilitate the delivery. Next question. The earliest sign of hypocalcemia is option A, twitching. Option B, negative Chevstok sign, and option C, weakness, and option D, exaggerated DTRs. The right answer here is twitching. Option A. The earliest sign of hypocalcemia include numbness and tingling in the extremities, which is twitching, particularly around the mouth, fingers, and toes. These sensations, also known as paresthesia, often precedes the development of more severe symptoms like muscle spasm or tetany. So, muscle spasm, tetany also will follow the tingling or twitching in the initial stage of hypocalcemia. Next question. An irregular acyclic bleeding from uterus is known as option A, polymenorrhagia, option B, metrorrhagia, option C, oligomenorrhagia, and option D, menorrhagia. The right answer here is option B, metrorrhagia. Here you can see the recap topic portion. We mentioned about all these conditions. Menorrhagia, heavy bleeding. Metrorrhagia, acyclic irregular, last more days, 7 days. Menometrorrhagia, combination of menorrhagia and metrorrhagia. Then polymenorrhea, short and frequent. So it will happen many times but less than 21 days. Oligomenorrhagia, infrequent, irregular. It is happening more than 33 days. Then hypomenorrhagia, scanty light, very less bleeding, but it is occurring in small intervals like 2 days. So here the memory tip is the color codes also, and you have to remember the keyword. Meno is heavy bleeding, metro is acyclic or irregular, poly is short, less than 21 days, oligo is irregular, more than 35 days, hypo is scanty, 2 days. Next question. A patient has vitals BP 120/66, pulse 88, SpO2 99, RR 23. This patient should be classified in which triage color code? Option A, red, option B, yellow, option C, green, and option D, black. The right answer is option C, green. Triage color codes red, yellow, and green. Patient has vitals BP 120/66, pulse 88, and SpO2 99, respiratory 23. So this is looking like normal vital signs, and the normal vital signs of non-urgent patient is in the green triage color code. So if the vitals are varied like hypotension or hypertension, tachycardia, bradycardia, tachypnea, all these kind of patients can come under the category of yellow, and more serious patients like cardiac arrest patient or severe hemorrhage, this kind of patients can be in red category, which need immediate attention. Next question. Keeping a medicine in the internal cavity of the body in liquid form is called option A, inhalation, option B, instillation, option C, insertion, and option D, insufflation. The right answer here is option B, instillation. Drug instillation, also known as medication instillation, is the administration of a medicine generally in liquid form, either drop by drop or with a catheter into a body space or cavity. Next question. Identify the abnormality seen in these patients. pH is 7.25, PCO2 is 40, bicarb is 20, and sodium 150, chloride 100. Option A, metabolic acidosis. Option B, respiratory acidosis. Option C, metabolic alkalosis, and option D, respiratory alkalosis. Let us see the right answer. The right answer here is option A, metabolic acidosis. Here you can see the pH is low. pH is low means it is indicating acidosis. PCO2 is 40, that is also low. So PCO2 low means it will be alkalosis, and PCO2 high is acidosis. So here it is indicating alkalosis, but the general condition is acidosis. So it is not of respiratory origin. It might be compensating. So bicarb, you can see it is 20, that is less than normal, and the acidosis bicarb low is indicating acidosis. So it is of course metabolic acidosis with some kind of respiratory compensation attempt, but it is not really happening because the pH is going low, but the respiratory compensation is attempting. Sodium and chloride we are not considering for acidosis or alkalosis analysis. That is different subject. Next question. Which position is mostly recommended for rectal examination? Option A, lithotomy position. Option B, dorsal recumbent position. Option C, Sims position. And option D, prone position. The right answer is option C, Sims position. The Sims position is a semi-prone position where a patient lies on their left side with their right hip and knees flexed. It's often used for rectal examinations, procedures like administering enemas, etc. This is Sims position. You can see the diagram. Next question. A patient is having calcium level of 7 mg per dl. Identify the ECG changes seen in this patient. Option A, T-wave inversion. Option B, prolonged QT interval. Option C, prominent T-wave. Option D, peak U-wave. Let us go to the right answer. The right answer is option B, prolonged QT interval. A calcium level of 7 mg per dl indicate hypocalcemia. On an ECG, this would likely to be characterized by the prolonged QT interval. You can see this is hypercalcemia, this is normal, and this is hypocalcemia with prolonged QT interval. So prolonged QT interval is the characteristics of hypocalcemia. Here you need to know two things. First, you have to know the normal levels. So only you can identify the hypocalcemia. Then you have to identify the specific feature related to hypocalcemia, hypercalcemia, hypokalemia, hyperkalemia, etc. Next question. The smallest structural unit of protein is option A, peptone, option B, protease, option C, peptidase, and option D, amino acid. The right answer here is option D, amino acid. Amino acid. The smallest structural unit of protein is the amino acids. Next question. Contraindications of nasopharyngeal airway is option A, unconsciousness, option B, sedated patient, option C, skull base fracture, and option D, during dental procedures. Contraindication. So the right answer here is option C, skull base fracture. A nasopharyngeal airway or NPA should not be used in patients with suspected basilar skull fracture, facial trauma, or mid-face disruption, because it will further injure the skull cavities inside, and it can lead to severe conditions like CSF leakage or more serious complications. So we have to avoid NPA, nasopharyngeal airway in basilar skull fractures. Next question. Which of the following is not a vitamin? Option A, folic acid. Option B, lactic acid. Option C, nicotinic acid. And option D, ascorbic acid. The right answer here is option B, lactic acid. Lactic acid is a byproduct of muscle metabolism, not a vitamin. It is produced when body doesn't have enough oxygen to meet its energy needs. Here, the other options, folic acid is vitamin B9, nicotinic acid is vitamin B3, and ascorbic acid is vitamin C. The last question in this series, while using a cardiotocogram, the given fetal heart rate to uterine contractions relation shows the fetal heart rate gradually decreases and returns to baseline. But the nature of the deceleration occur after the peak of each uterine contractions is option A, early deceleration, option B, late deceleration, option C, variable deceleration, and option D, acceleration. Let us go to the right answer. The right answer here is option B, late decelerations. Late deceleration in fetal heart rate monitoring refer to gradual decrease in fetal heart rate that begins after the start of a uterine contraction and typically reaches its lowest point after the peak of the contractions. This type of deceleration indicating uteroplacental insufficiency. So we are winding up today's session now. Thank you all for watching this video. Please like, share and subscribe for more videos. Thank you so much for watching.